Welcome to an episode of One Question with Uptop Health, where our experts dig deeper on the topic at hand.
Hi, welcome to One Question with Uptop Health. And today the article we're going to cover is Design that Allows Users to Help Themselves. And we are joined by Michael Wu and Craig Nishizaki. And gentlemen, the question I have is, do you guys have any real world examples of design that allowed users to help themselves? And Craig, could you go first, please?
Yeah, sure. We were thinking through this in terms of the work that we've been doing over the years, as well as the in the healthcare specific work that we've done. And an example would be Premera member portal redesign or reimagining, where we worked on thinking about the experience for that member throughout their journey. So looking at how someone would search for a plan, compare plans, and then once they sign up, how they would learn about consuming their benefits, identify doctors that are in the network or providers that are in the network versus out, being able to get social proof, ratings and reviews to help them make a selection of a provider, looking at the pharmacy benefits, and all those things that a member would do and would want to do within that experience, so that they wouldn't have to jump out to different third-party services or other websites. And so in that process, we created a concept prototype that walked the member through that experience and allowed them to input some certain details up front, almost like a wizard, and then it would allow them to then interact with that experience once they were inside. So by doing that, you're really reducing friction, helping them to not have to switch context back and forth. And I think that's a really good example of how you can help someone do something for themselves. So Mike, how about another example from outside the industry?
Yeah, thinking about this, there's a project we did with Amazon with their digital device and customer support team. And it involved a product or feature called Message Us, which the goal of that was to deprecate the email channel that that they had been using for support and create an omni-channel text-based self-help chatbot throughout all their apps and devices. So for example, Prime Video, Kindle, Fire tablets, Amazon.com, etc. But branded specifically to that product or service. So imagine .com as the top of that funnel. And if a user goes there, then they would work their way down, select which product they would need help with. But then also that this chatbot needed to support all those products and services and the different ingress points. If a user decided to come in, say, through Amazon Prime, it needed to already advance the user down that funnel and just be smart in that way. So again, as an example, a user types a few keywords and this chatbot responds, with corresponding choices that eventually leads them to a self-help article on the web. And if that doesn't actually solve their issue or their problem, then they had the option then to speak to a live associate. But think of this as a progressive help experience, if you will. That starts with self-service. And then again, if the issue isn't solved, then you get to actually talk to a live person. And an important piece of this functionality, as I mentioned at the beginning, was that this feature needed to be able to pick up the conversation where the user left off. So that whole omni-channel, multi-channel experience was really key, and making sure, again, that it was on brand and seamless for all the products and services.
That's a great example. Yeah. And the last one that I was thinking about is the work that we did prior to our move into the healthcare focus with Mattress Firm. So Mattress Firm's the largest mattress seller in the country. And as we help them fix their e-commerce experience to improve conversion and improve purchases, they asked a big question. They said, what's the biggest reason someone wouldn't buy a mattress online? And so our team did some guerrilla research and found that the biggest reason was you wouldn't know what it was like to sleep on it. And so we did some studies, like I said, some guerrilla research where we went into a store to physically go through the process of buying a mattress. We went online to their chat functionality to interact with one of their customer care advocates or one of their inside salespeople to see what questions they would ask. And we came up with an online mattress finder wizard that we were able to design and build and then test in an ad hoc manner. And when we tested it, it actually increased conversion by over 50%. And so if you think about that from a self-service perspective, is looking at what the big problem is that's holding someone back from being able to take action, and then trying to figure out how you can help that that person take action in a way that's intuitive and trustworthy. And so with this mattress finding wizard, what we did was we thought about through the data we gathered, we thought about the big questions that someone has. You know, how do you sleep? Do you sleep on your side? Do you sleep on your back? Do you like a firm mattress, a soft mattress? You know, how big? Is it more than one person, et cetera? And by doing that and walking through that flow, it ultimately dropped them into a product page that allowed them to make an easier decision. And so if you think about big decisions that you have to make, guiding someone through that process helps them to make those decisions a lot easier. So I think from these examples, we're showing how self-service can work in a pre-sale, a support, as well as a educational perspective. And yeah, it's just something that we're really passionate about and real excited about, reducing the friction for patients, members, customers, employees, and applying self-service where we can.
Gentlemen, this was great. Thank you very much. And if you guys enjoyed this article, please subscribe to our newsletter. And if you enjoyed the video, please subscribe to our YouTube channel.